Hello, Angie Talks family. Good morning, good afternoon, good evening, wherever you're watching or listening from. My name is Angelina. Call me Ange for short, but I prefer to be called 21st century virtual nurse. When you call me 21st century virtual nurse, I will simply respond, Hello, how are you doing? I hope everybody is doing well. The topic I'm going to discuss is a bit heavy. It's cancer. Cancer has taken about two colleagues that I work with, two different kinds of cancer. So I just want to talk about it and create the awareness. This video is not meant to scare anybody, but we need to create awareness from time to time. Go for a screening, go and do screening. The particular cancer I'm going to talk about is colon cancer. So we need to go and do screening, especially if you above 45. If you are 45 and above and you haven't done any screening at all, this is the time. I hope this video will encourage you to go and do some screening. So let's talk about cancer in general for now. Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. So, your body cells have what we call the cell cycle. That's when it grows and then it has a cycle. It grows and then the old damaged cells are killed by a process we call apoptosis, which is cell death. So that keeps the cells in control. It's divide, it's reproduce and divide, and then the bad the old ones are killed, and then new ones regenerate. But when that process the process of cell death, apoptosis, that mechanism is distracted. Cancer cells, the cells grow out of control and it forms tumors in some areas. And then when the tumors become cancerous, they spread to other areas of the body. Any part of the body can be affected with cancer. We can develop cancer from any part of the body because our bodies are made of trillions of cells. So any cell in your body can become cancerous at any point in time. So, cancer can start almost anywhere in the human body, which is made up of trillions of cells. And because of the spread, sometimes the cancer can start from the brain and spread to the lungs and other organs and tissues around. If you are still wondering how does cancer start, cancer develops when the body's normal control mechanism stop working. Old cells do not die and instead grow out of control, forming new abnormal cells. These extra cells may form a mass tissue called a tumor. Some cancers, such as leukemia, do not form tumors. So we have like a cancer like leukemia. It forms in the blood. It's a cancer, blood cancer. So that doesn't form tumor. Let me show a picture of normal cell. When you look at a normal cell, it's nicely arranged. But when they look at the cells in they use microscope to check the cells. If it's cancerous, this is an example of what they will see. You see, you don't. This doesn't show normal arrangements. It's all over the place now. It's very, very messy. So sometimes when they suspect cancer, they take a tissue biopsy and take it to the lab and examine to see if there's any change in the shape of the cells. They call it cell morphology. So they look at the morphology of the cells and see if there's any change, abnormal change in the cell formation. When they suspect cancer, after it's gone through the biopsy and the microscopic and they've checked it through the microscope and stuff like that, they will send the patient for further examination to confirm it's a cancer. So cancer diagnosis in itself can be scary and overwhelming for the patient and family. When you are newly diagnosed of cancer, it can be really, really daunting. If you look at this picture, this look like an she's not old. She's a young mother with a child who has been diagnosed with cancer. It affects everybody in the family. It's it, it's a sad moment, especially depending on the stage of the cancer. We have stages of cancer. We have stage one when the cancer is just localized, when it hasn't spread to other tissues. Let's say if it started in the lungs, it will only be in the lungs. And sometimes they will just do surgery to remove the cancer. So I said the first stage, when you are diagnosed with cancer and you are lucky, they tell you it's stage one. Stage one cancer is a small invasive mass or tumor that has been found, but there's no spread to nodes, to lymph nodes or other tissues. Sometimes it's called early stage or localized cancer. That is the stage one. So if you are somebody who does regular screening, you who go for regular checkups and screening, and one of your checkups they tell you they find something and it's confirmed it's stage one cancer, then you are among the lucky ones. The stage two one is called localized. That is, cancer has started to affect nearby tissues. That's when the cancer has started to affect the nearby tissues. The mass may have grown in size and then spread to lymph nodes near the mass. So there is a little bit of spread going there. And then the stage three is called regional spread. That's cancer affects more surrounding tissues. This stage, the cancer has affected more surrounding tissues. The mass may have grown in size and spread to distant lymph nodes away from the mass. So it has spread from the original place where it started and gone to other areas. And then the stage four cancer is what we call distant spread. The word distant rings a bell already, right? Cancer in this stage, with this stage four, cancer has spread to other tissues or organs beyond the region where it's originated. So sometimes it's called advanced or metastatic cancer. When it started, if it started in the brain, it has spread to the lungs, the diaphragm, the liver and all. It's messy at this stage it's very messy. So let me talk about colon cancer because that's my main focus for today. the in short, when you have the the way to fight cancer is frequent screening. Even though you don't have any signs and symptoms, we have to do regular checkups and screening because cancer is becoming too common these days. Everybody should think about going for screening just to prevent anything. Sometimes it will happen, especially if it's hereditary. But when you catch it early, the earlier you catch it, the better your chances of survival. As I have just explained the stages and how it spread. So when it's caught at an early stage, you have a high chance of survival. The cancer can be treated or eradicated, and then your chances of survival or total remission is great. I said cancer diagnosis can be very daunting for the person and the family and friends as well because the future is uncertain, especially if it's diagnosed at the latter stage. When it's metastatic cancer, it has spread from the original area to other tissues and cells and organs. It's very difficult to cope with it psychologically because you don't know the future. Let's have a look at this one too. It's a young family, but the lady has been diagnosed. with cancer, and looking at this family, depending on the stage, hopefully it's not stage 3 or 4, so they have a chance of fighting. And cancer survival also depend on the type of cancer. Some cancers are more aggressive, they spread faster than others. So what can we do to prevent cancer? We have to do screening. Folks, sometimes you need to dig deep into your pocket and then go for screening, especially if you are here listening to me and you can afford it. You are rich. You've made some money, so stay healthy to enjoy your money. It's okay, go to a private clinic or something, request for requisition for screening. If you have to pay for it, pay for it. You can't put a price tag on your health, and your health depends on you. Your health is in your hand. All these machines are diagnostic machines, MRI, CTs. When they do it, it shows the picture where whatever they suspect will be seen here, and then treatment will commence if cancer or something is seen. So sometimes you just go. I know a couple of patients who just came for one CT for one reason, and then they found something that looks like a tumor, and they were sent for further examination, and it was confirmed they had cancer. They didn't even know they had cancer. So early screening is very, very important when you are trying to prevent cancer. Sometimes lab tests too can show, depending on the kind of lab test they order. So let's talk about colon cancer or colorectal cancer. Colon cancer is the third leading cause of cancer death in the United States, but it grows slowly and sometimes the symptoms are very subtle, so people don't pay attention. So, colon cancer is a type of cancer that begins in the large intestine, which is the colon. The colon is the final part of the digestive tract. Colon cancer typically affects older adults, though it can happen at any age. It typically affects older adults 45 years and above. It usually begins as small, non-cancerous, which we call benign clumps of cells called polyps. So it called polyps when it starts that form on the inside of the colon. Over time, some of these polyps can become colon cancer. So this gentleman here, the picture you see, they are doing rectal examination, they put in a tube with a light over there to check. And the most common test they do is called colonoscopy. That's one examine the colon to see if there is any polyps. They will remove it, they will cut it off to prevent it from becoming cancerous and spreading. So this is a picture of the large intestine or the colon. When they do it, they will find the polyps, as you can see over there, and then it will be removed. If it will be removed before it even starts to develop into cancer. Polyps may be small and produce few, if any, symptoms. So it doesn't produce symptoms. That's why I said colon cancer can be very deceptive. By the most times, unless you go for the screening, by the time they find out it has already spread. I lost a colleague who just went for screening after her 50th birthday. She decided to go for screening, and they found out she had cancer, colon cancer that has spread. She fought for 2 years, and unfortunately last month she passed away. May her soul rest in peace. So because it doesn't produce symptoms, it's recommended that regular screening test is recommended to help prevent colon cancer. So they will identify and remove the polyps before it turns into cancer, like I said. So if colon cancer develops, many treatments are available to help control it. One of the treatments is surgery. They might do surgery to remove it. Sometimes radiation therapy and drug treatments like chemotherapy is targeted therapy, and it's like chemotherapy are all done to fight the cancer. Colon cancer, sometimes it's called the colorectal cancer. It's a term that combines the colon cancer and rectal cancer. Sometimes you have both the colon cancer and rectal cancer together. So it's called colorectal cancer. It begins in the rectum. So let's talk about the symptoms of colon cancer. The signs and symptoms of colon cancer, it's common to other conditions. So just go for a test to confirm it's not cancer or it's cancer. One of the symptoms is a persistent change in your bowel habit. That will include like diarrhea. If you have persistent diarrhea or constipation or a change in the consistency of your stool. What I mean is a change in what I mean by a change in the consistency of your stool is if your stool becomes very watery or very hard than usual. So that is a change in consistency of your stool. And then rectal bleeding or blood in your stool. If you notice rectal bleeding from your bum or blood in your stool, don't take it for granted, especially if it doesn't happens just once and it becomes continuous, like persistently. You notice rectal bleeding and then blood in your stool. And then when you have persistent abdominal discomforts, such as cramps, gas, or pain. Cramps is when your bowel begins to move, like not bowel movement, but cramps. You feel the cramps inside your bowels, your abdomen, and then gas. You pass through a lot of gas and then pain. Don't take it for granted. And then if you feel like your bowels doesn't empty completely when you have a bowel move, after having a bowel movement, you feel like still your bowel doesn't empty. It hasn't completely emptied and it's consistent. Also, weakness or fatigue could be a sign of colon cancer too. It's not confirmed. You can't just confirm it. You have to go to the hospital and for diagnostic tests to confirm. So don't take it for granted. When you begin to experience an unexplained weight loss, an unexplained weight loss is when you are not on diet or exercising vigorously to lose weight, but you just beginning to lose weight for no reason. So if you notice any of the above symptoms that worries you, make an appointment to see a doctor. And then the causes that like doctors aren't certain what cause most colon cancers. In general, colon cancer begins when healthy cells in the colon develop changes, which we call mutations in their DNA. When the colon cancer affects the cells that line your colon. So if there is any change we call mutation, then it's mutation in the DNA. It causes the cancer. That's what doctors think. Let me show you an example of a cancerous cells. If you look at this is a very messy colon cancer. It has spread if you look at it carefully. All the middle part is the cancer. You see some of the cells are still there, but the cancer it's spreading. When cancer affects you, when you have cancer, the aggressive one, they spread to your lymph nodes, your tissues, your organs. As they spread, they form their own blood supplies. We call it collateral blood supply. They form their own blood supply. So when you eat, it takes away the nutrients the oxygen and everything, and if it feeds itself with it. So you become very anemic, weak, loss of energy, as extreme exhaustion. You experience all that when you have metastatic cancer, because the cancer also the cancer feeds its cells with your when you eat with your nutrients. It's very aggressive. It sucks every nutrient that you it comes it's supposed to be going to your cells, and it feeds itself with it. So I said before, healthy cells grow and divide in an orderly way to keep your body functioning normally. But when a cell's DNA is damaged and becomes cancerous, cells continue to divide with no mechanism to stop it. Even when the aren't needed, they continue to divide. And the cells, they accumulate. When they accumulate, they form the tumor. So with time, the cancer cells can grow to invade and destroy normal tissue nearby, and cancerous cells can travel to other parts of the body to form deposits there, which we call metastatic cancer. So this is a cancer cell in the middle. You see how its shape is different from the normal cells, and with time it will divide, it will spread and invade other cells and tissue as it will go along. Let me show a picture of the bowel. This is a picture of the bowel. You see how the cancer has messed everything up over here. And this is a cancer, bowel cancer or colon cancer inside the colon, the lining of the colon. It can spread. This is a pancreas. If care is not taken or it's not diagnosed on time, by the time it's diagnosed and it's too late, it will affect the pancreas over here too, because when it spreads, it's spread all over the place. I will show you a picture of what I'm talking about here. See, this has affected the cancer has spread. Unlike here, it was just localized, but it's over here, it has spread, and the pancreas has is even affected. This one will affect other areas, other tissues around it. The entire digestive tract will be affected. This is what has happened, and the next picture is even worse. Here, at this stage, you can't even figure out the original place where the cancer started, the place of origin. It has spread and invaded all the organs and tissues around there. Cancer is it's very messy. Cancer is very, very messy to deal with when it's formed, when it's spread. It can be very messy. So let's the only way to fight cancer is frequent screening. As I'm talking now, I haven't done the screening myself, and it's a wake up call for me as well after what happened to my colleague. And I've passed that age. Right now, I'm 47. I have to go and check. At the age of 45, you are advised to go for screening. So I'm even late. I have to go and do it. 45 is the recommended age, but if you have a family history of cancer or colon cancer, it's even advised that you go in earlier. You do the screening earlier before the age of 45. So let's bear in mind. We don't want to die from cancer if it's preventable. Colon cancer is one of the preventable cancer if caught early on time. But unfortunately, because it doesn't give us, when the polyps are forming, it doesn't give us early signs or early warning signs. We don't we By the time we are diagnosed, it's mostly too late. That's the unfortunate aspect of colon cancer. As if already know by now, one of the risk factors of colon cancer is older age. So it can be diagnosed at early age, but a majority of people with colon cancer are older than 50 years. The rate of colon cancer in people younger than 50 have been increasing. It's been increasing. Doctors are not even sure why. That's why I'm saying you don't have to wait. They recommend 45 these days. It used to be 50, but now, because of the increasing number of people who are diagnosed with colon cancer are less than 50 years old, it's recommended that at the age of 45, you have to go in and check, do the screening. And another risk factor is African American race. What else? When it comes to diabetes, hypertension, high cholesterol, everything. So I think our race puts us at risk for all these diseases. So if you are African American race, like me and you listening, and most of us, we have a greater risk of colon cancer than other races. So we have to hurry up. We have to, I mean, encourage ourselves and go for the screening. Also, a personal history of colorectal cancer or polyps. If you have already had colon cancer or non-cancerous colon polyps, you have a greater risk of colon cancer in the future. So you should be going for regular screening, regular colonoscopy tests, and colonoscopy screening and stuff like that. So they will catch anything before it becomes too late. Inflammatory intestinal conditions to put you at risk. So diseases like chronic inflammatory diseases of the colon, such as you ulcerative colitis and Crohn's disease, can increase your risk of colon cancer as well. Another risk factor is inherited syndromes that increase colon cancer risk. Some gene mutations passed through generations of your family can increase your risk of colon cancer significantly. Only a small percentage of colon cancers are linked to inherited genes. So this one, only a small percentage of colon cancer are linked to inherited genes anyways. The most common inherited syndromes are increased colon cancer risk, are familial adenomas polyps. I don't really want to go into the biological parts, but just know that inherited syndromes that increase colon cancer risk. So, but it's not that common. Family history of colon cancer too, you are more likely to develop colon cancer if you have a blood relative who has had the disease. If more than one family member has colon cancer or rectal cancer, your risk is even greater, especially if it's a mom, a father, a brother, or a sister who has had colon cancer. It increases your chances of developing colon cancer as well. It could be genetics. Low fiber, people who consume low fiber, high fat diets are at risk. Colon cancer and rectal cancer may be associated with typical Western diet, which is low in fiber and high in fat and calories, the food we eat most of the time here. It's low in fiber and high in fats and calories. Fat is good. Healthy fats are good. Don't get me wrong, but we need to incorporate fibers into our diet as well. Some studies have found an increased risk of colon cancer in people diet who eat diets high in red meat and processed meat. That is the research. So, and processed meat and processed foods are not even good for anybody to begin with. People who are inactive are more likely to develop colon cancer as well, like sedentary lifestyle. Getting a regular physical activity may reduce your risk of colon cancer. So get up and walk, exercise. If you are diabetic, you have diabetes, your chances of developing colon cancer is also great. So people with diabetes or insulin resistance have an increased risk of colon cancer. Obesity also puts you at risk. People who are obese have an increased risk of colon cancer and an increased risk of dying of colon cancer when compared with people considered normal weights. So if you are obese and you have colon cancer, your chances of dying from it is even greater than somebody who is normal weight and has colon cancer, because the weight itself put a strain on your organs, the heart, your respiratory tract, and stuff like this. And then when you combine it with cancer, your chances of survival is really, really low. Smoking also may have an increase. If you're a smoker, you may have an increased risk of colon cancer. And then alcohol, like not normal alcohol consumption. Heavy use of alcohol increases your risk of colon cancer. Every risk of alcohol, it's may erode the protective lining of your stomach anyways, in your colon. And remember, colon cancer affects the lining of your colon. So if you're a heavy drinker, your chances of developing colon cancer is great. And sometimes radiation therapy can also put you at risk. Radiation therapy that's directed at the abdomen to treat cancers increases your risk of colon cancer. So sometimes treating one cancer can put you at risk for developing another. Like I said, the prevention is screening. Doctors recommend that people with an average risk of colon cancer consider colon cancer screening around age 45. But people with an increased risk, such as those with a family history of colon cancer, should consider screening sooner. Several screening options exist, with its own benefits and drawbacks. So talk to your doctor about your options, and together you and your daughter can decide which tests are appropriate for you. So you have to change your lifestyle changes to reduce your risk of colon cancer is necessary. Take the necessary steps to reduce your risk of colon cancer by making changes in your everyday life. So, like sometimes it could be like eating a variety of fruits, vegetables, and whole grains. Fruits and vegetables and whole grains contain vitamins, minerals, fiber, and antioxidants. Antioxidants helps fight free radicals. So all these fruits and vegetables play a role in cancer prevention. So choose a variety of fruits and vegetables so that you get an array of vitamins and nutrients. Drink alcohol in moderation, if at all, to reduce your risk. And then stop smoking. Talk to your doctor about ways to quit that may work for you. Exercise most days of the week, at least 3 to 4 times a week, a minimum of 30 minutes. It shouldn't be any strenuous exercise. Just brisk walking or cardio is better. And then maintain a healthy weight. If you are at healthy weight, work to maintain your weight by combining a healthy diet with daily exercise. Your diet is very important if you want to maintain the weight. I heard like it's 70% diet if you want to maintain or lose weight. It's 70% diet and 30% exercise. That's what I heard. So if you are exercising, make sure your diet is balanced. And it's also important the time you eat. The time you eat also affects your metabolism, which determine whether you gain or lose weight. Colon cancer prevention for people with a high risk. Some medications have been found to reduce the risk of precancerous polyps or colon cancer. So talk to your doctor about this and then see where you will take it from. You have a chance of survival with cancer if it's diagnosed at an early stage. So the signs and symptoms I mentioned, if you are feeling any of those, don't hesitate to go and see a doctor. Don't just go to the pharmacy shop and buy something painkillers over the counter and take it. That will just mask the symptoms for a while and then it will come back. Before I end the program, let me mention the symptoms of colon cancer. That the symptoms that will show you are having colon cancer, or the symptoms that should raise a red flag. That is constipation, diarrhea, alternating diarrhea and constipation. These ones become consistent, or other changes in your bowel habits. Rectal bleeding or blood in the stool, abdominal bloating, cramps or discomfort, a feeling that the bowel doesn't empty completely after you have a bowel movement. You feel like your bowel doesn't empty completely. Stools that are thinner than normal. This is another picture to show how messy colon cancer can be, just like any other cancer. When it's spread, it becomes so messy, like this one. If the lining of the stomach is even melted and it has spread all over the place. So let me leave you here and by saying your health is in your hand. Go for screening, take care of your health, change your diet, incorporate more fiber into your diet. If you are not you don't have celiac disease or anything that prevents you from eating fiber, exercise 3 to 4 times a week, or if you are lucky you can exercise the whole week. At least 30 minutes will help. Remember, the page name is Angie Talks on Facebook and Angie Talks One TV. Take care, everyone. There's no price tag for health, so don't put any price tag on your health. Love each other and take care. Bye.